First of all, my name is Larry Mackey. I'm with Lake County Health Department, and I developed a frog in my throat in the last 5 minutes, so that's probably not served me well here. But my role there, I'm Deputy Director of Prevention Services, which is largely the environmental health programs that I oversee. So been with the department a very long time. I'm not going to tell you how many years, but it's been a lot of years. So I'd like to tell you from the start, on November 2nd of last year was the first time that we became aware of the fact that we had 2 facilities in Lake County that were permitted to emit ethylene oxide. Prior to that time, I got to be honest with you, I hadn't known a lot about ethylene oxide, and everything I'm going to tell you today I've learned since that point in time. And you know, we've had to become much more knowledgeable in order to assure that we can fulfill our role. And so everything I know, you know, we've learned since that point in time. So I kind of want to give you a little bit of the basics of just the chemical, a little bit about that, a little bit about what the regulations are and whose authority is, who has authority in these matters, and then everything we've learned to this point in time. I'd like to share that with you as well today. So ethylene oxide is a colorless gas. It's used pretty extensively in this country. It's used really for 2 main purposes. The first main purpose is to make other products. It's used to make, surprisingly enough, personal care products like shampoos, conditioners, lotions, and things like that. It is used in the production of those kinds of personal care products. It's also used to make antifreeze. It's very commonly used to make ethylene oxide combined with water and a little bit of acid will make ethylene glycol, which is antifreeze. So second use, and that's probably of interest to you all here tonight, is it's used to sterilize medical and dental equipment, and that's how it's used at Medline. Other sources of ethylene oxide in the environment, probably the other main source that we'll see in the environment is vehicle exhaust. So it can be produced there as well, but again, the primary uses are in those 2 areas. So people are going to be exposed through inhalation, through contact with the skin. Oddly enough, ethylene oxide is a liquid below 50 degrees. So if it was in a refrigerator, it would be liquid. At room temperature, it's a gas. So people can be exposed through ingestion, they can be exposed through inhalation, which is the most common way that people are exposed. Probably the reason why I'm here tonight is in December of 2016, the US EPA, which has authority over these matters of assessing risk and assessing chemicals and their potential impact on people, they reassessed ethylene oxide and determined it to be a known human carcinogen. And that was in December 2016. Prior to that time, it was a potential or a possible human carcinogen. At that point in time, they had done a study, and actually it was done through the US EPA, and it's called an IRIS. The US EPA has a lot of acronyms, and I'm going to try not to use a lot of them with you tonight. But the IRIS report is the Integrated Risk Information System report. So that report was produced, and what that report determined was that ethylene oxide was a far more potent carcinogen than was previously believed. So what that did then, US EPA also has another acronym, which is NADA, which is the National Air Toxics Assessment Online Map. So the current map now is a 2014 map, which oddly enough was updated in August of 2018. But at that point, that map was redrawn, or it was reassessed with ethylene oxide to be known to be more potent than it previously had been. So it reset the parameters of that map. And what that map is, and this is directly from EPA, you know, it's a risk screening tool. So what it's supposed to do, I don't know if you all have seen that on the US EPA website, there's a box drawn around, and what that is supposed to say, to tell people, is that it's a tool that's designed to depict areas where there's potential for increased risk of cancer. And so again, with the reassessment of ethylene oxide, actually there were a couple other chemicals too at that time. Some of those areas were redrawn, and at that time, that's when we got a box around Medline in Waukegan. The maps, again, are designed, according again to US EPA, to be tools to assess potential risk, why it exists, and then determine if it indeed does exist. So at the time that it was drawn, it was drawn largely in response to that reassessment of the chemical, but then what it was supposed to do then, the purpose of it is to say, okay, there's something potentially here, is there something here? So the maps don't represent known areas of higher cancer rates. That's not the design of that. Again, it's to depict areas of increased potential risk. Due to an error with EPA, some data wasn't included, and so you'll note, if you go and look at that map online, you'll note that there's not an area around the Vantage site in Gurnee. But that was because data wasn't reported properly, and so US EPA and Illinois EPA have said that that was due to an error, so that was left off that map. But the thing that we know as the health department is that there are no known clusters of cancer in any areas here, especially those areas, or specifically those areas, but any other areas that we are aware of in Lake County. So again, that map is, again, for potential increased risk. So after November 2nd, when we became aware of this, we started researching this. We started saying, what is it that we can do? What role can we have in this to make sure that we fulfill what our role is, which is to help make sure that the people that are responsible for regulating these things are doing their job and protecting the health of the people of Lake County. Our primary concern is that, just like the primary concern of the city of Waukegan, the village of Gurnee is the same, to protect the health of the residents and assure that what's being done will make sure that that happens. So US EPA, while Illinois EPA is essentially a part of US EPA, they have different roles. US EPA's primary role in this matter, which is the United States Environmental Protection Agency, their primary role is to do these risk analyses, establish levels that are considered to be safe or unsafe in terms of exposures, and then to set emission levels for people that are using these chemicals that would then be considered to be acceptable. So their role, again, is to assess and then to set these levels. The Illinois EPA, their role is to issue the permits and to enforce those permits based on those standards. So there's slightly different roles, slightly different responsibilities. Now, Lake County Health Department's role, again, we have no regulatory authority in this matter. What we do have is, again, the interest of protecting the health of the people here in Lake County. And so what we've been trying to do in this whole matter since November 2nd of 2018, we've been just trying to gather information, work as leaders, and work with the affected communities, and work with both the Illinois EPA and the US EPA to try to get information, to try to find out what's being done, what can be done, and what will be done. So we've had opportunities to gather information. We've had conference calls. We've had 3 conference calls with US EPA and Illinois EPA, one and or the other. We have met in person with the US EPA down in Chicago back in November, the end of November. As a health department, our team, we have a team of about 4 or 5 people that have visited both sites and met with the management at both the facility in Gurnee and both Medline here in Waukegan. We received, we were required to file a Freedom of Information Act request with Illinois EPA. We received information on the permitted levels of emission and the actual emission levels. We received that information from the Illinois EPA. So what do we know so far to date? One thing we asked from the beginning was that the US EPA set up a website. If you, I mean, sort of going back in time prior to November 2nd when we became involved, obviously the first case that received attention was a Sterigenics case in Willowbrook, and what US EPA had done there was set up a website, and so we requested that they do something similar for Lake County, for our residents here, so that we can have a central point of information where the agencies responsible for these regulations and for enforcing these regulations can have that central point where this information can be distributed to the public. It can be in one spot. It can be, that way we're not getting mixed messages, we're not getting multiple messages. They did create that site. There is information on there, and some of the information I'll share with you right now is on that site now, and that one bit of information that is currently on the site that I would share with you is that both the Vantage facility and the Medline facility here in Lake County have agreed to install additional emission controls. Those are voluntary steps that they're taking. Those were not regulatory steps by the Illinois EPA, but they did voluntarily agree to install additional controls. They're slightly different because Vantage is a chemical facility that uses ethylene oxide in the production of other products, whereas Medline rather is sterilization. So there's slightly different methodology going on there. So there's slightly different controls that are going to be put in place. But those, according to our contacts with those two facilities and with and is also as reported on the U.S. EPA website, those are supposed to be in place by the end of spring, by the end of the first quarter, sometime in the spring of 2019. So we haven't had an update on that. That is on the website now. That we have not had contact with those two facilities in the last probably month or so, but we did have a conference call with the Illinois EPA on January 17th, and they told us that those are on track to be installed by the end of the first quarter of 2019. Aside from that, the U.S. EPA has not been very active in updating that site, and it's something that we're going to request that they will push that they do a little bit more, get more information. Whether there is more information to share or not, I'm not certain, but I would like them to at least go into that site and evaluate it and make sure that they've got the most current information on there for the public. There's also the Vantage site. I know it's not of primary interest to here, but they will be doing some air monitoring there. Medline has not committed to doing to do any air monitoring on site at this point in time. Our department, again, has no regulatory authority in the matter, but have advised that there's that some, as they're calling it, fence line or site air monitoring be done, both prior to and after the installation of the additional controls. But we have not, at this point in time, received a commitment yet from Medline on that. There has been, if there is interest, and if you'll allow me a few more minutes if you're interested, there has been air monitoring that's been done around the Sterigenics site in Willowbrook, both by the U.S. EPA and by some independent testing firms. That information is available online, and I would encourage everyone to Google that information and look it up. There has been the most recent results from the Sterigenics site is posted from November of 2018, and again, the reason why I mentioned that is because each site is different, but the more information we have, it is instructive to what we're looking at, especially with the Medline site, since they're similar facilities. They had some detects on the EPA testing in the parts per billion, low parts per billion range, both on the independent testing and the EPA testing. In our meeting in Chicago at the U.S. EPA, the U.S. EPA did say that they would be doing some modeling of exposure levels, and not to get too deep into the weeds, but when an emission standard is set to say you can emit X number of pounds of this material into the atmosphere, there's not a direct correlation to that would result in this exposure to a person 1,000 feet away if they're there for X number of hours per day. And EPA has committed to doing some of that that modeling of those exposure levels. And the other thing that they had mentioned was that they were going to be doing an more in-depth analysis of cancer rates in those areas. Whether that's going to occur here or not, that's not something that they have committed to at this point. Our last conference call in January of this year, a couple weeks ago, the EPA did indicate that their information was that they thought that there might be a review of those standards that were established. Again, those levels for what they considered to be safe exposure were set at a very, very, very strict level, and so whether EPA will look at that again or not is something that we're not sure of, but the Illinois EPA seems to think that they're going to do that. There has been legislation proposed, and again, that's a bit outside of our lane here at the Health Department, both at the federal and at the state level. Not sure where that's going to go at this point, but that would potentially put some additional restrictions on the use of ethylene oxide or the emission of ethylene oxide. The one thing that I sort of would like to end with is, at local government, city government, county government, I think we're kind of used to seeing problems, addressing problems, getting problems resolved, moving to the next. we would all love to see this happen with this problem at the federal level and at the state level, but primarily this is an issue at the federal level. And I think we all are aware of the fact at this point now this is going to take a little bit of time to resolve and work through. And again, whereas we would love to see this resolved next week, have some sort of answer, I think there's going to be some time that's going to have to lapse before they can come up with some sort of solution and figure out whether or not those standards are going to be adjusted, whether the permits are going to be adjusted, where we're going to go with that. And again, our role here is to try to work with you people here in the city of Waukegan, both the elected officials and the people here, and the people in Gurnee and the other affected areas, to make sure that we're trying to make sure that, again, everyone is doing the best to try to make sure that this is going to be accomplished to protect the health of the people the best that we can. Okay. But we're in kind of a tough spot here without the regulatory authority to do so. We're just, again, pushing and working the best we can to try to bring the parties together. And for the people, someone asked me at Gurnee, what can people do? And what I would recommend people do is do research. Google is your friend. Look up information. Try to educate yourself. I spent a lot of time. Again, I had no idea what the ethylene oxide really even was prior to November. So learn the best you can. And we're trying to put this into context for people and make sure people are aware of the fact that there's potential risk there. We don't know at this point in time what that risk truly is, and we're trying to work with the EPA to figure that out.
Well, thank you very much, and I know there was a lot. I think there's a lot more questions and answers at this point, but partnering with you as you move through this process and finding out as much information we can from those regulatory authorities, we'll try to disseminate that to at least to our residents and others. So just continue this partnership, and when updates come, we'll invite you back and we move from there. Now, there's a website that's out there. Can you give that website again, please?
I don't know the exact. If you Google Illinois EPA Lake County ethylene oxide, it'll come up.
I'm gonna get better than David. Don't we have attached to that website on our page, correct? Okay.
There you go.
So we have a copy of it. That links directly to the U.S. or state.
It's US EPA, yes.
US EPA. All right. Thank you, Larry. Appreciate very much. Oh, I'm sorry, Alderman Taylor.
I just wanted to mention a couple things. One, if I'm not mistaken, with fence line monitoring, the one concern with that is that if they're not operating at full capacity, you may not get as accurate readings as what could be happening there. Am I correct? So that has to kind of be worked out a little bit.
Yeah, there I know, again, this is not my area of complete expertise, but my understanding is there are different methodologies where you can do a grab sample. You just take a sample, but there are other methods where they set up a sampling device that samples over a 12 or 24-hour period. So I think there are ways to take that into account.
Okay. Some other great information is that you actually talked at the Gurnee Village meeting last week, and it was a special meeting, so it was 90 minutes. So it goes into more depth. So that's a great source. The other thing is Dave Savini is doing a special. He did it last night on Channel 2 News, and I believe part 2 is tonight on serogenics. And that also is informational for, if you're just looking to know how to become educated on the subject, those are great places. I list those on my Facebook page also, so if that is Ann Taylor, Alderman Waukegan 9th Ward, so if you want to use those as a resource, that's available to you too. But what I suggest is, residents is start to become educated on the subject. Thank you very much for coming tonight.
Thanks, Larry.